Welcome to the Pause It podcast. I am Dr. Sam, and with me, as always, is Dr. Robert.
Happy holidays, everyone.
And we are really excited today because we are joined by Dr. Stein, or Emily. Welcome.
Thanks.
We're really so excited to have you here. So you're representing a company called TEEF, and I can't wait to talk about this. This is very exciting. I just took out 21 teeth out of a dog today. So we had a dental complete oral health assessment and treatment. And I 21 teeth in one day. So I can't tell you how important I think oral health is in our pets. And I am just beyond excited to talk to you today about this.
Excited to be here. Interestingly, the reason I jumped into dog dental was because my rescue dog, her name was Tinsley. She was a 10-year-old Cocker Spaniel. This was after my grandmother's stroke from dental. She, after I rescued her, about 36 hours after I rescued her, we were in the ED getting 21 teeth extracted.
Oh, no way, really?
Yeah, and her body pumped full of antibiotics because her perio was so bad it advanced a bloodstream infection.
Oh my
That's
goodness.
coincidence.
Wow.
So it was 21. I mean, $6,000 on my credit card. Luckily, I had enough credit
to get.
So pet care is expensive.
My goodness. Wow. Yes. Right. Exactly.
Yep.
And so I guess this all goes together with our whole point of trying to be proactive, trying to do things that will kind of enhance their health and try to save money all at the same time. So
Yes.
I think we all have the same goal. And wow, Robert, would you have just died if you had to take out 21 teeth in a dog?
I honestly I can't even take out teeth. That's the thing. Like, I haven't done it in such a long time. Like, I have to call people. I'm like, I don't do this anymore. Like, unless it's falling out of their mouth in the ER room, I can't do it. So I'm like, I call someone like you. I'm like, hey, help.
Hey, take out these teeth.
Yep. So I
Oh
love what
my
you're doing
goodness.
otherwise. So for a clean
Yes.
breath.
Well, if you don't mind giving us just kind of a quick introduction into just who you are, how you came to do what you're doing, I think everyone would love to hear it.
Sure. So I am not a veterinarian. My doctorate was in microbiology. I spent 6 years at Berkeley studying how microbes survive as a community against antibiotics, antiseptics, heavy metals, radiation, nutrient deprivation, how they survive that stress by working together. And create resistance mechanisms. And then because my family history, we have a lot of autoimmune disease in my family, I jumped ship and went into human and spent 7 years officially as a postdoc fellow at Stanford in rheumatology, where I was focusing on autoimmune diseases like rheumatoid arthritis, lupus, and type 1 diabetes. And there was always an angle that involved the microbiome, which is the microbiology or the biome that is microbial, the bacteria, archaea, viral, parasitic, you name it, fungal microbes that inhabit the being. And they're always involved somehow in chronic inflammatory diseases. And then my grandmother had a stroke from dental disease. And so that's what caused me to circle back and focus on an area I know a lot about. And it turns out that dental is, you're right, entirely preventative. And when it progresses to a point where it's life-threatening, like for my grandmother, or 3 years later for my Cocker Spaniel rescue, it becomes very expensive. But it really can change the outcome of their life. Every tooth loss decreases lifespan. In a dog with perio, they can lose about a third of their lifespan. In humans, we can lose about 10 years of our lifespan.
Just from losing a tooth? I've no one's ever said that. Like, I've never heard that before.
Yeah, the minute you lose a tooth, you're super advanced stage. So it's the lining that the periodontum that lines the root of the tooth that is the socket that goes into the soft tissue and connects to the jaw, that gets eroded by the immune system and the microbes together in a long-term scary dance that happens below the gum line that you can't even necessarily see until you can wiggle the tooth, right?
Mm-hmm.
then it's too late. By the
That's when I
time it
come in.
rebuilds, it's too late.
Wow.
And that's super late stage. And by then the microbes have gone inside, they've penetrated into the blood vessels, they've gone up into the brain, they've gone into the cardiac, and it's gone systemic by that age. So
Mhm.
you want to
Amazing.
really do preventative.
Yeah. Well, it is interesting too, because you really do try, at least for me, because I'm in primary care, right? So the kind of opposite between Robert and I, he he takes care of all the emergencies, and I do all the try to do the education and try to say, hey, from day
Yeah.
one, get them used to brushing their teeth. And I can't tell you how many people look at me like I have about 15 heads when I tell them to brush their cat's teeth. And I'm like, well, you
No.
can do it. You really can. And it doesn't even have to be every day. I mean, yes, if you could do it every day, that's best. But if you can do it 3 to 4 times a week, you will make a big difference. And so I think when people hear that there might be some sort of passive way, whether it be with like one of the actual chews where they really
Mhm.
can actually indent in and actually get some passive work done,
Yeah.
or the foods, or things like that. But
Yeah.
up until now, my understanding is really stuff that you add to the water really hasn't been very good. And I'm curious to know what your thoughts are, and where
Yeah.
you kind of came up with this idea, and maybe just explain a
Mhm.
little bit about it.
Yeah, yeah. So yeah, when my grandma had a stroke, I looked at what was on the market. And I was like, why isn't what my grandma was using working? Right? Because she was brushing her teeth. She had also had Sjogren's syndrome, so she didn't make a lot of saliva.
Hmm.
Interestingly, a lot of cats and small dogs also don't make a lot of saliva.
Do you think
So
that accounts for why it is so many of those breeds have just, I mean, we look at a Yorkie and I'm like, well, we will be doing a dental by next year.
yeah,
Like,
no, totally
I mean,
right.
yeah.
I mean, they have overcrowding, they have
Hmm.
small mouths, and then they also don't produce a lot of saliva. And there's a lot of enzymes that the liver makes and things like that that help just control microbial populations. They don't often drink a lot of water.
Hmm.
So a lot of those microbial toxins build up, which
Mm.
cause
Okay.
inflammation. Cats as well, they don't drink a lot of water. Um, and so we have some big issues with smaller breed dogs and cats just regularly.
Hmm.
Interestingly, in our studies, your average Yorkie or Dachshund will have 3 times as many microbes in their mouths as like a Great Dane or a German Shepherd.
Really?
I do not doubt that based on what I see every
Oh.
single day.
No Yorkie
Yeah,
has teeth that I see. They're all like 17 and toothless across the
Hmm.
yeah,
board.
And
yeah.
poodles, and yeah.
Yeah, it's sad, because I on average in humans, and I don't know how this translates in dog years, but every single tooth loss is about a year to year and a half lifespan loss in a human. So it's got to be more either equal, or I don't know how that works out in dog years, but it's demonstrated now in epidemiologic studies, and in all the stuff on the market, it obviously isn't working because gum disease is escalating in
Hmm.
frequency
Yeah.
in dogs and cats and humans, horses too,
Oh,
even though they call it something different. And so, you know, antiseptics, which are in the toothpastes and the mouthwashes and the dental chews and the dental treats and the water additives, those just take the problem and temporarily knock it down, but they don't affect the problem. You know what I
Hmm.
mean?
mm.
They just
Okay.
Kind of hide it.
globally knock down the burden of microbes by like 25 to 50% in our hands for about 2 to 3 hours, and then they start to grow back.
Oh,
So
seems ineffective.
yeah, basically, yeah, because the root cause of from all the understanding over the past 30 years is actually due to the slow decline as we age. Doesn't matter if you're a mouse or a dog or a cat or a human. As we age, you get a decline in the number of good beneficial microbes that inhabit the mouth, and you actually get an increase. Sometimes it's dramatic increase in the number of harmful microbes that are usually antibiotic resistant, usually antiseptic resistant, and those guys just wind up taking over. And that correlates very strongly with dental disease.
Yeah, I mean, it makes sense, right? And that is very smart. And it's kind of crazy that that's not, are you having trouble getting people to understand and kind of look at things in this different way? Because it is a bit of a paradigm shift. I mean, we all brush our
Yeah.
teeth, we floss, and anytime you bring something new in, I'm sure you get a lot of people that are like, oh, so I'm curious to
Mhm.
know. I mean, it's compelling what
Totally.
you're telling me. So,
Yeah, I mean, it's tough because you're fighting against probably a century of dental microbiology in humans, because we're in the human space as well, and then probably about 50 years of dental microbiology and veterinary, and it's the same. Everybody thinks that you need to kill,
mhm.
and that's actually, you know a century of data shows that it does a little bit of benefit, but by then, within about 2 to 3 weeks, you're already starting to see signs of inflammation in the gum tissue again, and
Mm.
things like that. So it's just a temporary band-aid. It doesn't necessarily try to correct the problem. And so um, we're trying to teach everybody that you actually need good microbes to inhabit your mouth and your gut. We now,
Right.
I think the field knows that, like, you need good guys in your gut, but this
Mhm.
is the start of your gut, and it's so
Yes.
close to your brain. So you
Mhm.
have one highway that goes to your brain, and you have one highway that goes to your heart, right? And a lot of dogs wind up getting cardiovascular disease if they have dental, or they get renal problems or
Yeah, the
kidney
kidneys,
problems.
yeah. Mhm.
Dementia is even linked in humans and dogs to perio, because one of the key
Mm.
contributors, we think, is porphyromonas, which is one of the leading causes of gum disease, and also maybe Alzheimer's.
Wow.
Wow.
Yeah.
Yeah, and I think you mentioned even too, like, they're only just starting to recognize in dogs how truly there is cognitive dysfunction, and I have
Yeah.
to people are very surprised because 'cause they're like, my dog's really acting," and they kinda go through this list. I'm like, "Yeah, this is just like sundowning." I mean, like, all the
Yeah.
things that if you've ever
Yeah.
taken care of an elderly,
Yeah.
family member, this is what your dog is doing, and I mean, how many of them have horrific dental disease?
Yeah.
A lot of them.
Yeah, I
You
know.
know?
We've done 3 clinical studies in Alzheimer's, older, just independently living adults with gingivitis, and then um really really scary mouths in nursing homes. So yeah, and believe it or not, they have the same microbes that your average later stage dental disease in dogs and cats have. A lot of
Really?
Really?
fungal, lots of fungal.
In the
Uh,
mouth, really?
yeah,
Oh,
gingivostomatitis we're finding in cats is driven a lot, correlates really strongly with very high candida burden, and aspergillus, and some of the other
huh.
Kissing's
lesser
taking on a
known.
whole new meaning for me right now. So,
Oh,
like,
oh,
Jesus.
fungus is super scary. I mean, it
It's
it
like,
it, it tweaks our neuronal system and our immune system. It's
yeah,
super insidious.
that's
Wow.
fascinating, honestly.
So I'm curious because I have I have your
Oh, teeth. Yeah.
yes. And okay, so I have to confess I haven't tried it yet because I don't have the scoop. So
Oh.
I'm curious how
Oh.
how big it is.
Mhm.
What's the
Um,
how many teaspoons is it? I wasn't
It is
sure.
it's less than 1/16 of a teaspoon. Tiny.
And to
Tiny.
You
clarify
can,
for our listeners, oh, there it
what?
is. To
Is
clarify
this
for our listeners, this is not T's fault. This is my brother's fault who brought it home from the conference that did not deliver the little spoons. This is not T's
So
fault. This is
I got
clearly
it and I was like,
our
yes,
fault.
because I really want to use it so
I
badly.
know, it's like it's okay, so this is our human tablet that I built for my grandmother so she could just suck on it. It just came down from the International Space Station. They did a year-long stability study on it
Oh,
to give
cool.
to astronauts, because basically we're going after the market that easy to administer, can't brush their own teeth, requires someone else, is entirely dependent on someone else to take care of them, right? So that's astronauts that are up in the International Space Station without a dentist. That's dogs, that's cats, because only on average about 3 to 5% of American pet owners brush their pets' teeth regularly.
Yeah.
Older adults don't get their teeth cleaned regularly either. So that's, obviously where we're focused, is unmet needs. So it's a tiny dose because we're microdosing the microbes.
And
And
so
in the
what's
powder
in it?
form,
Just so
it's just natural powder. It's just literally nutrients for microbes. So it's taking instead of taking molecular sledgehammers that are in dental chews and all the things that are antiseptics that knock out any good microbes, these are actually prebiotics. So they're feeding the good microbes. And so they're starting to basically eat kind of foods we want them to eat, which are proteins, which dogs and cats should be eating anyways, right?
Yeah.
And then it's got a fiber, which is technically a postbiotic because it's made by soil microbes, which dogs should be digging in soil anyways, right? And getting a good inoculum of healthy soil bacteria. But this and some of that postbiotic. But this is a higher dose, higher potency postbiotic, which is an insoluble fiber, and it literally plugs up the fungus and all bacteria in the mouth from eating carbohydrate, which tends to be in a lot of these dental chews, dental treats, foods these days. Even in cat food, you're going to see a lot of carbohydrates, which should not be in cat food.
I agree. And that's a real fun one to try to explain to people. I know.
Yeah. So basically we're just putting the microbiome on a keto diet.
Cool.
There you go, listeners.
There you go. Everyone should be keto.
And then that just in the mouth though, and that tends to significantly reduce the inflammation. They're not squirting out all sorts of acids that are super inflammatory and cause leaky gums. You know, leaky gut, you get leaky gums too, and the microbes go inside and they can cause problems, like for my grandmother and my rescue dog. And so what we're trying to do is grow the good, stop the production of the bad things that cause gum disease and drive that inflammation. And then you wind up just having a better balanced mouth, and that winds up with healthier outcomes.
And I actually use it for my dog because I borrowed one from the conference as well. Used it, and actually his breath was better after 2 weeks. It was actually better. I really enjoyed it. So
yeah, there's nothing covering it up. I mean, it just happens that if you block sugar from being fermented by bacteria, they don't make stinky things anymore.
Yeah.
Wow.
It's been wonderful. So thank you.
Yeah. Man, I really want to use it.
I'll blame Nathan. It's fine.
No, I think it's really cool. And I think that's awesome. So for people, you have this disintegrating tablet that they'll just put in their mouth. Wow.
And we're coming out with the disintegrating tablet. It's going to be more like a children's aspirin. So it's going to be even smaller than this to go into the cheek of small dogs who don't drink a lot of our water and cats
That's
who also
brilliant.
don't drink a lot of water.
So can I ask then, for a cat that has, let's say, something more like stomatitis, where it's, you know what I mean? That's a totally different, is it going to help in that kind of a situation as well? And I guess, I bet you there's probably a whole bunch of stuff that we don't truly understand about stomatitis. So
yeah, no, and I'm still learning, trust me. I've only been working in cat now for about 4 years, heavy duty on the microbiology side, but I can tell you that the cats with stomatitis tend to have a ton of enteric microbes and fungus in their mouths, more fungus than dogs. And the kind of fungus is super resistant to antimicrobials, antibiotics. And then so fungus loves sugar. I mean, we ferment everything, right? Beer, wine, bread, that's all it eats is sugar. And so I think that the cats that are prone to stomatitis, we're seeing they have a ton of fungus in their mouths, and yeasts form, and filamentous fungus, and pretty bad stuff. Even I've cultured out black mold from cats' mouths before.
wow.
That's
Yeah,
horrible.
I mean, it's scary. Well, I don't know what they're being fed, but it's not okay.
Well, definitely too many carbohydrates in so many ways. I mean, there's no question that that is a paradigm shift that is very slow to change, because people are under the impression that their cat's teeth are going to be better if they eat dry food, which of course is absolutely not true. Because if you've ever seen a cat, they don't chew, they just grab and swallow because they are carnivores. And you know, obviously there's so many more carbohydrates in a dry food than in a canned food.
Yeah,
I have this conversation about 15 times a day. So
you're on the front lines, my friend. You are in the front lines.
but you know what the thing is I really have seen it make a huge difference in weight.
Yes.
And stuff where people don't even realize. They're like, oh, I thought that was bad for them. I thought that was what was going to make them fat. It's like, no, it's like the Atkins diet for your cat. Put them on the canned food. But I think it's interesting too, you know, cats that have FIV, I've noticed. So, you know, obviously that compromises their immune system. They almost always have horrific, awful gums.
Yeah.
Horrible.
Yeah. So, and what's interesting, and this is, I'm just drawing parallels with, I mean, I was in microbiology for longer than I would like to admit, but you get a lot of co-infections a lot, especially when you have an underlying viral infection. You're more prone to secondary bacterial infections, secondary fungal infections, just because the virus has its way with your immune system, right? And it will knock down part of your immune arsenal so it can survive and reproduce. And it's just a natural capability it has. And then you're subject to getting secondary infections. And for a cat with FIV, I'm not surprised, like, you know, that you get dental. A lot of humans with HIV are prone to dental disease too.
And you were
There's a lot of
saying
parallels.
about like the yeast, right? Because isn't thrush,
Yeah,
isn't that, I mean, and isn't that
thrush.
quite common with, so I mean, I guess I never even really truly, it's until someone points it out to you and you're like, well, why? That's so obvious. You know, that makes so much sense. But I guess it's not part of the paradigm. It's not what we're taught. It's not what we talk
No,
about. I mean, we
no,
barely in school even talk about teeth, truthfully, right?
Yeah, we
Like
didn't
we
have a
had
lot of
to seek it
education
out,
on it.
I know. And just
truthfully.
wait till I mean the just wait till what's being discovered and shown in dental research internationally. It's already being heavily disputed in the US, even though there's at least 15 to 20 years of data showing that there's no statistical difference between people who floss and people who don't floss. And that's numerous studies. And there's
Really?
no statistical difference between brushing teeth with an herbal toothpaste and brushing teeth with water and soda, so, you know,
Like baking
sodium
soda.
bicarb, yeah, baking soda and peroxide or whatever. But what does matter is the sodium fluoride. So
Okay.
it's not a physical thing per se. And in micro, we know, because it's been shown for several decades, that you brush your teeth, you're just smearing the microbes around. You spit part of them out, but then the ones that you didn't spit out reattach in 2 minutes. And
Two
so
minutes?
what we're doing is trying to change what they're doing. So you can smear them all over, you know, but they're changed in what they can do.
This
Well, I guess
conversation's horrifying me.
yeah, no, but it explains morning breath, doesn't it? Like we all brush our teeth, but we wake up with terrible breath.
Yeah,
Go walk
that's
around with fluoride in
because
my
the
mouth.
microbes are digesting all those blood sugars that wind up in your clavicular fluid at night. You know, so I always tell people to brush their teeth and then take our lozenge before they go to bed, or to make sure that they get, you know, if their dogs don't drink a lot of water, make sure that they at least get a heavy dose of the teeth powder before they go to bed. Dogs go to bed.
All right, well,
So is there a time of day then? I guess like that was, I guess, my
No.
next question, because it looks like you just dissolve it in,
Mm-hmm.
depending on their size, you know, the appropriate
Yeah.
amount of powder to water,
Yeah,
it looks
I will
like.
be honest, it's been so difficult uh because the diversity of dogs out there, and everybody has their own feeding habits, and it's really tricky to one size doesn't fit all. So what we've found is that, you know, if you have a multi-dog home and multi bowls per household and cat and dog mixed household, the dog formulation actually works in cats. We've shown that.
Oh.
It's not optimized for the cat microbiome. That's coming out in 2023 Q1. So that'll be coming in about a month.
cool. We'll have you back. Just kidding.
Yeah, I know. But it's all about more frequency, because the microbes don't stop. They're like, you have I mean, dogs have just as many microbes basically as humans do in our mouths, and every single lick or kiss transfers about several 100 million microbes, depending upon how juicy that lick is. Human kisses can be about 1 million. Just depends.
Horrifying.
How tasty that is. And so that's why it's not, WHO doesn't yet, World Health Organization doesn't yet recognize dental disease is an infectious disease, but it is truly an infectious disease. It's normally shared in households. So if someone has cavities and you share utensils or drinking or chapstick or whatever, you can spread the karyogenic microbes within the household. And indeed, we're
Just-
finding we've done a bunch of swabbing studies, and between pet owners and their pets, and they share a lot of the same
Oh
periodontal
my
pathogens.
gosh. Well, I think about how many times I'll look at a dog and they'll get you right in the mouth with their
Yeah.
tongue. So now I'm even more horrified by that.
We need mouthwash after this conversation.
Yeah, I know.
Just
Me too. I'm like, oh man.
yeah.
So basically it's just frequent, because we all eat frequently. And so the body digests, and that sugar goes right into the saliva and feeds those microbes, and then they poop out all sorts of inflammatory mediators and acids that cause leaky gums and periodontal disease. So so that's why we decided to first launch it in the water, because we're thinking that dogs drink more frequently throughout the day.
Yeah.
But raw fed, it turns out, and small dogs don't drink as often as we want. So we have to figure out other ways to supplement.
Mm-hmm. Gotcha.
Yeah.
And so I mean, I also think too, it is nice to have more than one avenue, right? So like, because you said, some dogs don't drink a ton. Some dogs drink a ton. But to have the lozenge, like as just like a, hey, just before bed, you do this.
Mhm.
That's brilliant, because I think that's quite simple. And if I told people like, yes, there is an alternative to brushing, I would be their favorite bet. So
Even though I've been like chewed out by vets by saying, you don't really need to brush, because the data really doesn't convincingly show that brushing works anyways. It's more about what you use with brushing. I think that works. That's more meaningful.
As far as what you're using to brush, or you mean like what you're offering? Is that
you can even put like our powder right on a toothbrush.
Oh, that's
and brush
cool.
your dog's teeth if you can. Like my puppy, Tinsley sadly passed away a while ago from cancer. But yeah, it was sad. But my puppy, he's now like 4 years old. He's been on since 3 months, and the little, I tried to raise him to brush his teeth, and he like would chew up all toothbrushes. So I decided, after spending $25 on toothbrushes, I was done. It was futile. So I just do, chew toys that I throw in the washing machine, because you need to wash those, because again, those microbes, you need to get rid of them.
That's a great
idea. And he gets TEEF every day in his drinking water. He's on a very diverse diet, very low carb diet. And good exercise. We play in the dirt a lot.
What kind of dog is he?
It's a good load of microbes. Huh?
What kind of dog is he?
Oh, he's a total mutt. He's a rescue. So I sequenced him, obviously, because that's what scientists do. So he's like German Shepherd, Lab, Pity, cattle dog. He's got all sorts of stuff in him. Super mutt, 7% super mutt. He has no genetic mutations that are susceptible to any diseases known. So he's
good to go.
So far, so good. Yeah. And he hasn't had to have a dental yet, and he's 4.
It's great.
That's great. That's
awesome.
phenomenal.
Yeah. Have you had any pets that you've seen on the teeth for is he the longest one that or do you have
well, he's been my patient 10. Our patient 0 was Tinsley. She didn't have to the few teeth she had left were fine. We didn't have to get those extracted. Yep. And then a couple of the other dogs, they're on it, and you can tell when they run out, because their breath comes back. That's the first tell. And that's the first sign, that reminder, because we're all busy and we all forget to reorder and stuff like that. But you do notice right away when you run out, because your dog's breath definitely changes.
Yeah.
Yeah. And a couple of things I've also noticed is, everybody in this day, we all want instantaneous change, right? An immediate effect. Yeah. And with our approach, we're really changing who lives in the mouth and what they're doing. So that can take some time, especially if it's advanced stage disease, or if the dogs are really older. So expectations need to be set too, as far as like what they should see. Like, we're trying to teach people to really look at the gum tissue for gum health. That's not taught. So puffiness and redness and swelling. And if it's orange and angry, that's not a good sign. Or if it's super red, that's not a good sign. You want something really nice and pink. And obviously when dogs go and play, it'll be a little bit more red because it's more vascularized because they were active. So but it should be really not swollen and really intact, you know? And then the tooth plaque and tartar, all the clinical data shows there's no real correlation with tooth plaque and tartar and gum disease. There is tooth plaque and tartar with cavities. That's different.
It's interesting that we don't really see a lot of cavities in dogs, which is
no,
yeah, we don't,
because the enamel is insanely tough compared to human, unless they chip a tooth or they break a tooth, then they're susceptible. But yeah, it's just with but that mindset in human dentistry has affected how veterinary dentists think.
Oh, interesting.
Yeah, and so actually they've shown, like King's College of London and you know all these prestigious dental schools, that it's not the amount of tartar or plaque, it's who lives in that plaque and what they're doing that really correlates with outcomes.
Yeah, I have actually said a couple of times to people like, yeah, the tartar and the calculus, they're ugly, but it's what's happening to your gum. That's the disease. And they, you know, some people be like, oh, okay.
Yeah. I mean, with what's interesting is by putting the microbes on a keto diet in the mouth, you actually do get less tartar and plaque because you change the plaque consistency, so it's less chunky and thick and sticky. It's more thin, and the microbes, it's usually several layers thick instead of tens and tens and tens and tens and tens of layers thick.
Will you actually see it start to come off at all, or is that still like you'll have to scale it? Oh wow.
Yeah,
that's cool, man.
We've had customers that just like literally can just pull it right, like really embedded calculus can just flick it off after a couple of weeks with a fingernail or just wipe it off if it's less advanced.
Especially with so many of our older, because almost all dentals, you know, when we get into these really big you know, procedures where they're usually not young, they have multiple comorbidities that you're dealing with, and then you're having to put them under anesthesia, and you know, you have these people who are terrified, you know, and it doesn't matter that we do this every day. I mean, it's still, if something happens, you know, anesthesia is not without risk. And so I always understand when people are like, well, I don't want to put them under anesthesia. I'm like, but their mouth, you know. So it always feels to me like we're between a rock and a hard place. We're always kind of saying, well, we got to do something, but at the same time, I get the fear, you know. So I don't have to do
you
that.
Guys are in the trenches. You're in the trenches.
Well, you help and give us an answer, which is nice. That this can help, you know,
it's great.
A lot of those older dogs with murmurs, even that, you know, like Sam was saying, don't want to go under anesthesia. That's huge. I've actually recommended to a couple of people already at my clinic, because I'm like, they're like, wait to get dental soon. I'm like, oh, so your dog's got a heart murmur, like try TEEF for a bit. I show them the website, and actually, do you want to show them? Like, it's very important how to get TEEF.
Yeah, how do we get it?
Yeah, that's really important. That's
I guess I'm a really bad salesperson.
that's what we're here for.
Probably a good thing. TEEFhealth.com. So TEEF health.com.
Cool. That's awesome.
Yeah, just Google TEEF.
Can we get the human stuff on there too? Because now I want it.
Yeah, exactly.
That's called generic. It's for it's I'm not a branding person and I named it. So it's called Daily Dental Care.
Daily Dental Care.
Perfect. All right. Definitely don't Google that because you won't find it, but you can Amazon find it.
Oh, okay. Cool. That's awesome. Yeah. I mean, I find this, I could literally talk to you all night. This is really amazing. I really do appreciate it. We won't keep you here much longer, but I have to tell you, I'm fascinated by this. I think it's really, really wonderful. And I know that there are people who will be truly, truly excited about this. So it's definitely something I'm really excited to kind of promote and talk about, because I'm truly just beyond excited about this.
Well, yeah, no, and honestly, you know, I've been working on this now since 2011. And we're still at the infancy of our understanding of the true power of the microbiome, and particularly the oral microbiome. You know, it's the second most biodiverse, bioabundant microbiome compartment in the body. It's close to the head, close to the heart, and close to the nervous system, right? And we know in the gut that, you know, most of the microbes are driving our hunger sensation, our moods, and development. And that's been shown now in multiple species. So it's not just dogs and humans, it's cats and non-human primates. And we know that what we're doing is growing good bacteria in the mouth, and that can have beneficial outcomes downstream with general urinary health and downstream gut health, and also skin health in dogs. So it's all, everything is connected. I mean, we've been doing this now for several years in dogs, and we're seeing some pretty remarkable co-occurrences.
Yeah, I'm hoping that you'll get just a lot more people being open to it, because they are actually in veterinary medicine talking more about the gut biome, and that there's even like a food now, you know what I mean? Like, so I mean, they really are trying to promote that, and I think that we are foolish to kind of take things as like, oh well, I just deal with this part of the body, and I just deal with this part of there's no such thing. I mean, we're all one being, and it all is interconnected. So probably the biggest mistake they've made in human medicine, which is like, I deal with the cornea. It's like
100% correct. Here's the big example. When you have a puppy, right, and they're teething, all of a sudden they get really teary-eyed or eye infections, right, or ear infections, because the microbes went up into the face. They don't just stay put. We're like just petri dishes that the microbes swim through and penetrate, right? And there's nothing like no real compartment to a microbe.
Yeah.
You know what I mean?
So you can use TEEF in a puppy?
Yeah. Absolutely.
Cool.
Highly recommend you start early, because they inherit their maternal, not just genetics from their parents, but they inherit the maternal microbiome.
Okay.
Except if they are C-section, then they get whatever the heck that environment was that they were born into. Whatever room or hospital, or you know what I mean?
But I think that's the same as children, right?
100%.
Who don't go through the birth canal versus the ones that do, or the ones that go too fast. Yeah. And then they don't even get that squish out, you know.
You don't get coated.
It's true. I'm telling you, my daughter had to be like, I mean, I'm really good at getting them out. So she got out a little too fast.
Like,
she gets squeezed.
Yeah. You know what's interesting is on the human side, we've been working, you know, we've been in human mouths for a long time. And the thing that we've found out was that our older adults, who are susceptible to yeast infections and urinary tract infections and stuff, if you clean up their mouths, they don't tend to get that.
And isn't that amazing? Because how many times would they'll say, like, people will start acting different, and then they'll find, oh, they have they have a urinary tract infection.
Yep.
It's like,
and dogs too. So an older dog, when you put them on TEEF, they might have more frequent bouts of urination, particularly nocturnal, for several days as they shed.
Oh, that's really good to know, actually, because then if somebody says that, hey, oh my gosh, what's going on? You're like, it's fine, it will pass. Just got to give it a minute.
It's just the shedding part, but that affects behavior sometimes in dogs. So they might, like, you know, we're finding all the things that the microbes were controlling when you're starting, because you don't realize that you're really controlled by your microbiome. You're not really in control of yourself. You feel hunger because they're hungry, and they're telling your nervous system that they need to be fed, right? Yeah. And what we're doing is putting them on a keto diet, and your sugar horse, you have fungus and E. coli, and, you know, they're not happy. And so they are spitting out and spewing out neuroactive peptides and small molecules and stuff that are really causing strife in your dog or your cat. But it's temporary, because the minute you get them out of there, then everything settles down and they're fine. But you have to, like, maintain it, because all these microbes are freaking in our water, and they're in our food supplies, and they'll just get recolonized, you know?
Yeah. Oh yeah, it makes sense. Oh, absolutely.
No, I love it. I'm a believer of this.
Yeah, I know, you got me. I mean, I'm totally with you.
Sorry.
No,
I
I
can nerd
love
out
it.
all
It's-
night long.
I know we really could. I know. And I have to say, thank you so much. I've really, really enjoyed talking to you. I can't tell you how much I appreciate it. I do hope you come back and talk to us again because
Sure.
man, I
Yes.
can't wait to hear more about cats and just the next iteration of this whole thing. So you just, I mean, we're just really excited. So okay, so TEEF, look it up and you can get it. Remind everyone where they can get the TEEF because I should have said it again and I didn't.
No, teefhealth.com.
TEEFhealth.com. Okay, perfect. And then Robert, just hit everybody with if they have questions.
If
for
anybody has
us,
questions
then we
about
can
TEEF
say- yeah.
or about myBalto or about Pause the Podcast, or you just have questions in general about your veterinary health, send it to podcast@mybalto.com. We're happy to answer those questions. And if they are for TEEF, we'll make sure we forward them along to you so we can get some answers. Because I think everybody, I can't wait to share this with people because I think it's just a great thing. So I love it.
Yeah. Oh man, we're really, really excited. So I just want to say thank you again so much for coming and talking to us. And this has been the Pause It podcast. Again, thank you everybody for listening and check out myBalto and have
See
a
you
great
guys next
night.
Thanks, guys.
Thank you.